dialogue with the Department of Health. I'm Ariza Francisco, the Deputy Head of the Ateneo Policy Center, and I will serve as your host for today's discussion. And to formally open our policy dialogue this morning, I would like to call Ms. Ivy Rose Baisik. Ms. Baisik is the head of the Ateneo Policy Center, the policy think tank arm of the Ateneo School of Government. Established in 2016, the center produces cutting-edge research, provides technical assistance to public and private sector actors, and hosts evidence-based policy discussions such as this one to support political, economic, and social reforms and advance nation building. So without further ado, Ms. Ivy Rose Baisik.
Thank you, Arisa. Again, to our partners in reform in the Department of Health, welcome to the State of Illicit Tobacco in the Philippines, a policy dialogue with the Department of Health. As mentioned by Arisa earlier, this policy dialogue is organized by the Ateneo Policy Center, the public policy think tank of the Ateneo School of Government. In 2019, we began a 3-year research project funded by the Canadian government's International Development Research Center, or IDRC, to advance tobacco's biggest public health threats the world has ever faced, killing more than 8 million people a year. Southeast Asian countries, namely Indonesia, the Philippines, Thailand, Cambodia, Singapore, and Brunei, have been able to raise taxes on tobacco products in recent years, and reports have suggested that the Philippines' sin tax law of 2012 has also been successful both in lowering consumption and in raising government revenue. Acknowledging the successes of the first sin tax law, the Philippines passed another law to further increase excise taxes on tobacco products until 2024. And through tobacco taxes, the government will be in a better position to fill the massive funding gap for the universal healthcare program. It is then crucial for us to ensure effective tobacco tax implementation in order to maximize the benefits for the Filipino people. This means addressing the issue of illicit tobacco or tobacco tax evasion, which poses serious threats to public health and public finance in the country. So this is why we are here today. We aim that through this space, we will be able to share with you the key findings of our work in the area of illicit tobacco trade. This morning, we have with us our fellows and researchers who will present their research on the magnitude of the illicit tobacco problem in the country and a review of the various current illicit tobacco trade programs and policies in the Philippines. This project on tobacco control and taxation is part of our bigger health and good governance initiative in the Ateneo Policy Center, which includes our works in the universal healthcare, health governance, the COVID-19 pandemic, and the anti-drugs campaign. And to conclude my remarks, I would like to wish all of you a fruitful and productive dialogue while offering our thanks to the Department of Health for its openness to collaborate with us. Again, thank you and good morning.
So, welcome to our colleagues. And our main objective in convening the group today is to first be able to disseminate the results of our 3-year research in the area of illicit tobacco trade. Our presenters would also be discussing some recommendations for specific policy options at the national level on illicit tobacco trade. And hopefully during our discussion, we'll be able to brainstorm with the participants here on possible actions that can be taken at the national, regional, and local levels. Without further ado, we'll proceed with the presentations. So our first question for this morning is, how big is the illicit tobacco problem in the country? So to discuss the trend of illicit tobacco in the Philippines from 1998 to 2018, I'd like to introduce Ms. Monica Lavares. So Ms. Lavares is the lead author of this study as an economist and researcher of the Ateneo Policy Center, Ateneo School of Government. She obtained her master's in economics at the Ateneo de Manila University and her bachelor's degree in economics at San Beda College. So please give a round of virtual applause to Ms. Monica Lavares. Monica, go ahead.
Thank you, Ariza, for that introduction. For today, I will be discussing, on behalf of my co-authors, Dr. Hannah Ross, Ariza Francisco, and Dr. Nadia Deutsch. I will be presenting today our paper entitled Analyzing the Illicit Tobacco Trade in the Philippines from 1998 to 2018. So, as mentioned by Ivy earlier, according to WHO, tobacco epidemic is one of the biggest public health threat in the world. And as of 2020, there are about 1.3 billion tobacco users worldwide, and 80% of this 1.3 billion users live in low and middle income countries. These are also the same countries wherein the burden of tobacco-related illness and death is heaviest. So every year, 8 million people die from tobacco use, and 1.2 million of which are deaths of people who are non-smokers but were exposed to secondhand smoke. So the WHO has given its key measures that need to be acknowledged and implemented by each countries in order to reduce the demand for tobacco. So these are some of few. So secondhand smoke kills, pictorial health warnings work, bans on tobacco advertising, taxes are effective in reducing tobacco use, tobacco users need help to quit, and lastly, illicit trade of tobacco products must be stopped. In the Philippines, the government has made significant advances in using several tobacco control policies, especially tobacco taxes such as the sin tax law, to control tobacco consumption. As of last year, 2020, the excise tax is now at 45 pesos per cigarette. However, tobacco industry lobbyists continue to warn the government about the possible negative effects of tobacco tax increases. Apart from the job losses among tobacco farmers, these lobbyists also argue that a higher tax on tobacco products will lead to more illicit tobacco in the market. In 2019, um, the Philippines was considered as a favorite transshipment point for smuggled cigarettes. However, there are also reports of seizures are frequent in Freeport areas such as Subic, Batangas, in southern Mindanao, particularly in Zamboanga, Basilan, Sulu, and Tawi-Tawi. These are areas wherein maritime patrols are easily evaded. However, there are very few studies which measure the size of illicit tobacco market in the Philippines, and this is where our research come into place as it tries to fill the void by providing estimates of the size of the illicit cigarette market and its trend over time. So for our research objectives, so first we wanted to calculate the cigarette consumption of adult smokers in the Philippines in terms of cigarette packs and cigarette sticks. We also wanted to provide estimates of cigarette consumption, estimates of illicit cigarette consumption, and lastly, we want to identify if there is a relationship of excise tax increments to the trend of illicit cigarette consumption in the country from 1998 to 2018. So for our data sources, so our main three data sources are just mainly coming from the smoking prevalence and smoking intensity. So in the Philippines, we do have 6 data points coming from the National Nutrition Health Survey. So these are the years 1998, 2003, 2008, 2013, 15, and 18. However, these surveys are only capture adults aged from 20 years old and above, while the government allows legal consumption for Filipino adults from 18 years of age. So, meanwhile, we do have another sources of data, such as the Global Adult Tobacco Survey, or GATS, what takes into account Filipinos aged 15 and above, but they have only conducted 2 surveys at the moment, which is in 2009 and 2015. Our second data would be on the cigarette removals. So same with the smoking prevalence. We do have this data from 1998 to 2018. These were obtained from the Bureau of Internal Revenue through the help of the Department of Finance. The tax removals represent the cigarette volumes sold on the domestic market, both locally produced and rough imported. And these are all cigarette packs that were subject to an excise tax. These do not include removals that are exported from the Philippines yet. And then lastly, we do have the Philippine adult population, which we got from the Philippine Population Census from the Philippine Statistics Authority. So for our methodology, we use the gap analysis. This method is based on comparison of the legal sales and the self-reported cigarette consumption estimated from surveys. It is expressed as the cigarette gap is equals to the legal sale to the cigarette consumption minus the legal sales. So the legal sales refers to all legally sold cigarettes taxed by the government, and the cigarette consumption is the annual consumption of cigarettes by the adult population in the Philippines. Cigarette consumption is further calculated as the adult population times the smoking prevalence times the number of packs consumed per smoker times 365 days. Further, the cigarette consumption is then multiplied by an uplift factor. This is to account the secular difference between the official sales and self-reported consumption and the exclusion of cigarettes consumed by those under 20 years old from the consumption estimates. This results in adjusted cigarette consumption. The year 1998 was selected for the calculation of uplift factor because this is the earliest year wherein all data were available in our time series. So we calculate the uplift factor as the legal sales in 1998 divided by 84%, all over calculated cigarette consumption in 1998. We assume also that in 1998, the illicit cigarette market is represented as 16% of the total consumption. This is based on the Euromonitor estimate. Yeah. And then, so for our results, first, we compare the cigarette legal sales and the estimated cigarette consumption from 1998 to 2018 in the Philippines. The legal sales initially increased from 70 billion sticks in 1998 to its peak in 2013 with 97 billion sticks. Even though 2013 data were affected by the industry stockpiling cigarettes before the expected tax increase in 2014. Meanwhile, the calculated annual consumption was substantially lower than the reported legal sales, possibly the result of underreporting of cigarette consumption in the surveys, missing youth and tourist consumption, and other factors such as imprecise population size. After the implementation of the sin tax law, both legal sales and self-reported consumption declined from 2013 to 2018 by 22.19% and 8.82% respectively. So this figure now shows, sorry, this figure now shows the adjusted cigarette consumption using the calculated uplift factor of 1.74. Now, the cigarette consumption is somewhat higher than the legal sales, and the gap between the consumption, which is the I think the diamond dot beyond above the graph, um, and between the consumption and the legal sales represents the size of the illicit market. Using the adjusted consumption figure, we estimate that from 1998 to 2018, about 61 billion illegal cigarette sticks were available and sold in the Philippines, an average of 10 billion sticks or 10.7% of the average total cigarette market annually. The highest volume of illicit sticks can be observed in 2018 with 14.5 billion sticks or 61% of the year's total market, while the lowest volume of sticks was in 2013 with 1.6 billion sticks, equivalent to 1.66 of 2013's total market. Taking the upper and lower bound of the consumption estimates, the share of illicit market ranges from 0% in 2018 and 2013 to 24.8% in 1998. However, the difference in estimate across years could also be attributable to the industry's varying degrees of stockpiling. Also, to shed a light to the arguments made by the funded studies on the size of illicit market in the Philippines, we also performed a sensitivity analysis by lowering the Euromonitor estimate on the share of illicit cigarette, which is 16%, by 25% and 50% respectively. So that would be 12% and 8% as the base of the illicit share in the country. According to our lower bound estimates, illicit cigarette market in the Philippines was negligible in 2008, wherein it's around -1%, and then in 2013 with -8%, in 2015 as it only reached about 2%. So there. So graphically, I like to show this to you in a graphical manner. This is how it would looks like comparison with the trend of the excise tax that the Philippines has made since 1998 to 2018. The illicit cigarette market share dropped by a whopping 42% from 2003 to 2018 and continued to decrease an additional 79% from 2008 to 2013. The decline of illicit cigarette market share from 2003 and 2008 may have been influenced by other tobacco control legislations and policies. By 2018, the share of illicit market had increased again to a prevalence comparable with its 1998 level, even though the more than tax rate tripled more than 3 times, or even though the tax rate tripled in real values during that time. This clearly demonstrates that there is a limited or no concrete relationship between the size of the illicit cigarette market and the tax rate in the Philippines. So as you can see here in the graph, we've been since in 2003 and in the 2003 to 2013, there have been strong legislations on tobacco control, and and similarly with the sin tax, which was implemented in 2012, the share of the illicit market has been going down since then. So again, there is no concrete relationship of tax increments to illicit cigarette trade activities. So ways forward, what we wanted to do is that future studies should apply alternative methods to cross-verify our estimates. Continuous effort to monitor the cigarette gap and identify possible factors that would increase the gap. Third, we also recommend that there is a strong tax governance, monitoring, and implementation must always be in place and complementary. And lastly, there is a need to implement an effective and efficient track and trace mechanism on domestically produced and imported cigarette products. Think that's all for today for me. If you have any questions, I'll be happy to answer them during the discussion. Thank you.
Thank you. So now we will proceed to our next presenters. We will look at how the country has taken action in addressing the issue of illicit tobacco trade. So to present a review of the illicit tobacco trade programs and policy implementation in the Philippines, I'd like to introduce Dr. Lester Geroy and Mr. Paolo Encarnacion. Dr. Geroy is a research fellow in the Ateneo School of Government under the Advancing Tobacco Taxation in Southeast Asia, or ATSI project. Dr. Geroy is currently the chairman of the board of the Philippine Society of Public Health Physicians, where he served as founding president from 2017 to 2020. He is a public health physician with focus on health policy, systems, and financing. He is also a consultant of the Alliance for Improving Health Outcomes, Physicians for Peace, DOH, PhilHealth, PCHRD, UNICEF, and WHO, among other organizations. He started to work on tobacco control policies in 2018 with the DOH and with the Ateneo School of Government for this project that will be presented today. So Dr. Geroy completed medicine at the University of the Philippines College of Medicine, and he also completed 2 master's degree programs at the University of the Philippines Open University and London School of Economics and Political Science. So his other work include health systems, planning, policy, and financing in rehabilitation, palliative care, mental health, disabilities, DRR, and antimicrobial resistance. On the other hand, I'd like to introduce Mr. Encarnacion, who is also a research fellow at the Ateneo School of Government under the Advancing Tobacco Taxation in ATSI in Southeast Asia project. He is an early career development researcher and manager with a specific interest in health systems and implementation research. He serves as the project manager for the rollout of the PhilHealth Benefit Package under the Alliance for Improving Health Outcomes. and the project officer of the Philippine Society of Public Health Physicians. Paolo has supported policy dialogues, project analysis, and planning for the Framework Convention on Tobacco Control, or FCTC, and the regional tobacco control networks with the national government agencies. So let me turn the virtual floor over to Dr. Geroy and Mr. Encarnacion. Lester and Paolo.
Thank you, Ariza. I hope you can hear me well. And it's a great day. And thank you also to Monica for the previous presentation for setting the context on how difficult it is and one of the methodologies that we use to monitor illicit tobacco trade. She also gave us a picture of the realities in the Philippines, the difficulty of collecting data, and also the limitations also coming from like one methodology. So this group is actually like a reunion for myself and Paolo, no? Because as Ariza mentioned, we have worked closely with DOH, I think starting 2018, to check on the policy developments and implementation of FCTC. And this group, as you will notice, is also very DOH group. So in the actual face-to-face, although part of the recording will be shared later, the actual lectures, but the participants is just a small group, since you want to focus on the health sector and health policy. So next slide, Paolo. So this study was project by IDRC, and we implemented under the ATSI project and also under the Ateneo School of Government. The presentation does not necessarily reflect the views and positions of any agencies. And personally, our interest, me and Paolo as public health and health policy analysts, our interest is really for public health and for the greater good of our society. So we declare no conflict of interest with the tobacco industry or any other front organizations. Next slide. So this is just a usual discussion for research, give you a little background, but definitely the presentation of Monica has provided us a good background also of the possibilities that it actually happens in the Philippines, and what are the considerations to compute for illicit trade. I will start with the background and methods. Paolo will be discussing results, and then we'll give you some recommendations and some specific action points. Next slide. Next. So tobacco, as you have seen also from Monica, it's a big factor. And the Philippines is actually a great country in terms of tobacco policy. We are very active in FCTC. We have shared international experiences in terms of policies. Other countries are also looking at us for all our experiences. And even our local governments have tobacco control task forces and they have tobacco control policies at local governments. We have the famous Red Orchid Award. So we're actually doing a lot of things. But the illicit trade is one area which even in our dialogues when we talk to health officials in the regions, in local governments, it's like a black box. Nobody knows what it is. Nobody knows if it really happens or who is in charge. And what are the developments in this? And even as we did the review, there's been a lot of efforts on graphic warning and ads and many advocacy campaigns on tobacco control. But this part is again like a black box. So when Paula and I started to work with DOH also to review FCTC, it inspired us to, hey, let's take a look at this and maybe try to check what is there. It was mentioned recently then that we had recent laws, the sin tax law in 2012 and also the 2019, which increased excise taxes, which is basically also what we are using now for health sector reforms and for UHC. And you have heard of the debate that the tobacco industry would say that if you increase the taxes, illicit market will also increase. So it's always been a debate, although quite recent research is showing that it's not necessarily true, and it's a different thing. And basically, what we really just need is for illicit market to be controlled is um, efforts really on the government to monitor it and to curb it. So yeah, definitely illicit products still undermine tobacco consumption because of the addiction that it creates. And as mentioned also by Monica, studies in the Philippines and reports are actually very limited, especially when it comes to illicit trade. Next slide, Paolo. So with that, and coming from our backgrounds, Paula and I, we are more into health system, public health, and policy. So this project was basically to review and check the provisions of our national policies on illicit trade, compare it or benchmark it with international policies um, in terms of its compliance, and then also review who is in charge. So analysis of stakeholders, and then review what has been done. So what activities, programs, what is there in the country and how it's being implemented, and of course some facilitating and hindering factors. So it's a qualitative analysis. Next slide, and quite broad actually. Next slide. So we divided our methodology into two parts. One is more on the policy review, and the second part is on implementation. The policy part is, reviewing the issuances, benchmarking it or reviewing it with international policies. Again, who is in charge? So looking at the stakeholders and coming up with policy recommendations. On the implementation side, it's looking at the national and local level of implementation and validation. How do they actually do it? And again, who are the agencies in charge and what programs are being done? So it's broad and it's a quick flash look. You can also see the link of our report. Next slide, please. In terms of policy analysis, what we did was we checked on and reviewed the policies that we collected from the different organizations, including DOH, DOF, Bureau of Customs, and checked all the other coming from their own websites on related laws and programs that they did, and then we used the WHO checklist for the checklist for the WHO protocol to eliminate illicit trade. So they have a self-assessment checklist, which is basically the first checklist that government agencies can use, in terms of how ready they are or what is their current status in implementing or in exceeding or in ratifying the protocol for illicit trade. And part of policy analysis, we reviewed, two reviewers reviewed independently the different policies and did benchmarking, evaluated it in terms of its compliance. So later on, we'll show you a brief overview of the results of that. Next slide. In terms of implementation, we actually sent requests to different government agencies. Some of them are not listed here because they didn't reply to us. But for those who replied, we were able to interview them and also get better ideas of their programs and policies, specifically related to illicit trade. And we know also that many of the actions that they are doing are actually just part of the bigger work, not only for tobacco, not specific to tobacco, but in general to tobacco control. So next slide. And I turn over to Paolo for the results and discussion. Again, keep in mind, it's two parts. It's the policy part, and then there's implementation part. So over to you, Paolo.
Thank you, Doc Lester. So for this part, I will try to briefly to make it as brief and as concise as possible, no, of what we have learned from conducting the interviews and focus group discussions with our participants. So firstly, for the policy analysis, as Doc Lester mentioned, we tried to map out and scope the available policies from available online databases. And coming from this manual search, we've somehow scoped these 12 policies flashed on the screen. We will not go over this one by one, but just to note, these are the policies that we've used in the benchmarking against the WHO illicit tobacco trade protocol self-assessment checklist. So, as Doc Lester mentioned, this self-assessment checklist is actually a tool suggested by WHO that could be used by the countries before acceding to the protocol to eliminate illicit tobacco trade control. No? Right. So moving forward, from this policy benchmarking, using the self-assessment checklist, we identified the major themes as identified in our protocol to eliminate illicit tobacco trade. Firstly, in supply chain, using this self-assessment checklist, we tried to score with the policies at hand, where the Philippines is at. So we scored it as a yes, a partial, or a no. And for each yes, we tried to somehow just to quantify where the Philippines is currently at. For every yes, we scored it as 1. And for every partial, we scored it as 0.5. And coming from this scoring system, we've identified that those in highlighted in red marks, these are the major areas or specific articles, points in the under the supply chain that we perceive as lacking based on the policies that we've reviewed. So for the supply chain, we have due diligence, tracking and tracing, security and preventive measure, and of course the sales by internet or other technology. Apologies for the typographical error. For the next two sections, for offenses and general obligations, what we've noted, at least for the offenses, most of the policies do not explicitly mention the specific provisions or articles that's mandated by the well, not mandated, but are required by the protocol to eliminate with its state parties, country parties. We have identified these articles: unlawful conduct and the disposal or destruction. And for the general obligations, there are specific provisions. It's not specifically identified here, but most of these provisions that are required by the protocol are mainly on coordination and cooperation, especially with other countries. We have noted that most of these agreements might probably subsume under existing bilateral agreements or multilateral agreements with other countries. But for this purpose, unless we see word per word, just to somehow be more specific with the provisions of the illicit tobacco trade protocol, we have noted for those provisions to be a no. All right, I hope that was clear. For this part, Doc Lester mentioned that we've also tried to map out the involved actors and stakeholders for in the implementation of illicit tobacco trade control policies and programs. And coming from the agency mandates, we try to somehow visualize sino nga ba ang dapat kasali in the discussions. Who should we tap so we could somehow increase our number in strengthening governance systems for illicit tobacco trade. And as you can see, we've tried to separate into two sections these agencies, those involved in the policy and those involved mainly in implementation. we tried to map out those who are primarily involved in policy, because we see these agencies as sort of the steering committee. They have the authority and the power to somehow steer all these agencies that are supposed to implement the policies and programs that are enforced or written by law by those at the policy level. So as you can see, most of these are actually involved. Most of the agencies involved in the policy level are primarily national government agencies, and of course, always in partnership with the LGUs, since we have this local government code. And for implementation, these are mostly agencies that are involved in the enforcement. As you can see, we have here the BAR strike team, RDOs, Bureau of Customs, Coast Guard, the DOJ for prosecution, this CIDG, and the LGU task forces, and the Metro Manila Development Authority. Right. So the very mandate or description of these agencies are detailed in the paper that we've shared via email. I hope that was received. And in the interest of time, we will not go into detail of each specific agency. All right. For the implementation practices, what we have noted in our interviews and discussions with tobacco control implementers, regional tobacco control network authority experts, we have noted at least in most of these provinces, there's the presence of their own task forces. At least for one one locality in Bataan, they have this municipal and provincial task force. They also have this existing reporting platform where citizens could raise issues in case there are any rumors. This is where they could report to, at least they have this open line where citizens could report to the local government. They also conduct regular inspections in Freeport zones, since this specific locality is covering the Freeport zone in Bataan. In another LGU, another practice, this one specifically in with the RTCN of Bataan, they have noted that their main role is really more of steering LGUs primarily towards smoke-free policies and the endorsement of the Red Orchid Awards. And really, what they have mentioned is really these LGU-led practices are what's really pushing forward tobacco control efforts, at least in their RTCN. And finally, in Davao, we have seen they have implemented stringent gatekeeping systems through the permit to sell. So retailers would have to secure special permits. So they would be considered as authorized to sell tobacco products, primarily cigarettes. And then they also conduct regular inspections of establishments, especially these registered business enterprises or RBEs. And they also started engaging at the barangay level. So while other LGUs have their own provincial and municipal task force, in Davao they're doing to as small as a barangay. So they have this barangay anti-smoking task force, which our informant consider as force multipliers. So at least in their municipality, at least in their city, these citizens, while they have only started with a very small team in tobacco control efforts, when they've started implementing this anti-smoking task force at the barangay level, it somehow dominoed to increasing the number of those increasing the vigilance at least at up to the barangay level. At the national level, what we have noted at least for the Freeport zones, through the Bureau of Customs, they are conducting risk management systems. This risk management system is what they use to assess whether um, an upcoming shipment or a container would have to be manually validated by one of their agents, would have to be scanned through an X-ray, or would have to be more lenient in passing. This is somehow how they allocate the resources, their scarce resources, especially in equipment and human resources, who would physically validate, the incoming shipment to the Philippines. We have also noted, that in our discussions, there's this existing collaboration between the BAR and the BAC, especially in conducting raids, enforcement of inspections, especially in warehouses, etc. And also, there was a mention, and I think this is, and we also noted this is in accordance with the law, that the confiscated products are publicly burnt, with the presence of the corresponding agency personnel. And one of the themes that we've identified, is that illicit tobacco is treated as similar with any other illicit product, and quote unquote, we have not heard about it, is mostly what most of our informants would say, and at least not the national level. We've also noted that agenda setting, is confined at the executive level, and by executive level we mean the top executives, the president, for example. One specific instance of this is the change, in the efforts, with specifically with the Bureau of Customs, where under the Duterte administration, they have specifically given special attention, to illegal drugs, as is the advocacy of our current president. Another key theme that we've identified is the availability of a reporting platform, especially at the local government unit. So we try to sort of create a framework on how LGUs could somehow do this whole process, considering illicit tobacco trade is really sort of an unexplored area. So we've noted na rumors is one big factor, because as we mentioned earlier, citizens really, at least for some of the LGUs that we've interviewed, citizens are really a big factor, in getting the tips, for, since they're the people in the communities, they're the people there, and then these rumors are getting relayed to the local government agencies, which local government agencies afterwards try to retrieve supporting information. They try to check whether the tip is valuable, and then if they do so find it valuable, they conduct raids and busts, to confiscate the illicit products, and subsequently file charges if kung kaya, and then afterwards they file these cases. They document these cases and report to the enforcement agency for documentation and for the monitoring of illicit trade status. All right. Just some limitations. While we have reviewed the policies, the scope policies, and benchmark it against the WHO ITP self-assessment checklist, the policy review was not yet done by legal experts. This was only done by two independent reviewers, and would have to be subsequently reassessed, especially since the language of the law might be different, and our interpretation might be different from the interpretation of our legal experts. And of course, we acknowledge that there was only a limited number of recruited participants from the national and local offices, and while this may not be as conclusive, we try to document here what could be replicated with our other local government units, since these are somehow our best practices, or at least something that could be replicated across other LGUs. All right, so over back to Doc Lester for some of the key messages and the recommendations.
So thank you very much, Paolo. And due to limitations in time, we cannot really give all the details, especially in the policy analysis. The link to our report has been provided, and you can also check it for some details, including also the specific actions, for example, of the Department of Finance, because it describes what are the programs and the activities that they also do. But again, it's really a lot, and as we mentioned, our capacity is also reaching its limit. Most of us here, including Paula and I, are also coming from the health sector. So it takes time, and it takes a while to actually understand also this issue from the legal and even from the finance perspective, which leads us, Paula, next slide, please. Next slide. So here are some of the key messages, and I'm in the last few slides. And just to emphasize, so in comparison to the illicit tobacco trade protocol, many of the Philippine policies are partially compliant, as Paolo has shown, and many of the mechanisms in place are working for agency objectives. But what is a bit, so there is a fragmentation reality here, and what we fail basically is to address illicit trade as a whole and as a macro level. And this, again, as Paolo mentioned, we need people also coming really from the legal side to really review this. Strengthening of key policy areas will definitely require new policy monitoring especially, and also communication approaches. So Paolo showed you earlier the ones with the green and red, and these we mentioned here are the parts that are more red. So these are parts that we need to take a look at again and to check. So it's due diligence, tracking and tracing, sales by internet, and so on. But we also invite other government agencies and other researchers to also consider this and explore and take a look, because there are many things that we might have also missed. DOH needs to work closely with key implementers, mainly BIR, with its partners PNP, Bureau of Customs, Coast Guard, and local government task forces for this specific topic on illicit trade. We know that DOH has worked really hard and has achieved much also in terms of other areas of FCTC. So this is, again, a part that we need to improve. Further studies by legal experts with perspectives on tobacco control, taxation, regulation, trade, and law enforcement should be sought to further review and assess the MAP policies. Because as we said, a lot of our perspective is really health system and policy and public health, but we will definitely learn a lot from the inspiration and the perspectives and the viewpoints from different fields. So largely, it really is from the beginning. It's really a multi-sectoral, and with a lot of people from the legal side and finance and public financing to take a look into. And finally, acceding to the ITP will remarkably benefit illicit tobacco trade control and serve as a catalyst for developing agency policies. And we have shown benchmarking using the WHO tool. So as recommended also by WHO and by the Conference of Parties, it's the first step to actually review and accede to the ITP. Next slide. So also coming from our policy and our program implementation, we prepared a few specific potential recommendations to DOH and national government agencies. And we are very happy here that we have with us key officers in the Department of Health who are in charge with specific areas. So this slide shows more on the policy and the evidence part. Recommendations that we could do. So number one, include tobacco control and policy in the research agenda. So for illicit trade, there are identified areas that we need to further explore, have research questions, and conduct research. Further studies by legal experts, again, with perspectives coming from the non-health or perspectives outside health and public health that includes tobacco control, taxation, public financing, law enforcement, and so on, trade, and so on. Third would be the use for government, for colleagues in government to review the ITP using the ITP self-assessment checklist, and we have provided a sample. It can actually be used by our colleagues in government, but we also recognize that we may have missed it, or some areas that are yes or partial. We may not agree, so it's open for everybody's use. And the checklist was really designed for government to review their current status. Number 4, accession to the illicit tobacco trade protocol, and include this in the agenda for discussion in the IACP. Number 5, engage involved NGAs, such as, for example, Bureau of Department of Finance, and establish a common framework for governance. Maybe perhaps through a JAW, identifying specific targets and strategic steps. So these are the more policy and evidence-related recommendations. The next slide, Paolo. The next slide are more implementation, advocacy, and more at the level of LGUs and also RTCNs. So first, develop new approaches in terms of advocacy, new approaches for communication. So just for example, we say protect UHC funds, reduce illicit tobacco trade. 7, include illicit tobacco trade in the Empower trading package. As mentioned, the Department of Health, or LGUs, have done a lot really, and the Empower training has big content, and has been very useful actually to the LGUs and the task forces. But this specific illicit tobacco trade is not yet, a big part of that. Include illicit tobacco trade in the Red Orchids awards criteria. So definitely we will need some specific indicators here to include that. And finally, request RTCN to monitor reports on confiscated illegal tobacco, because this is happening really in regions, in localities, and normally the RTCN does not collect, as I understand, does not collect data on this coming from PNP. Next slide. So Paolo and I presented also these 10 recommendations to the LGUs, and we are doing this. This is just a draft for DOH to consider, especially from the program side, the advocacy side. Recommendations that are specific and clear, because many of the LGUs and even the RTCNs that we have communicated with, interviewed with, they aside from they don't know if it's really happening or what it is, they also don't know what to do. So these recommendations, we kind of put it at LGU perspective as something that we could explore and recommend through the RTCNs. I'll just list this, and later in the open forum that we have, we can get some feedback also from you. So 10 recommendations. 1, include illicit tobacco trade in local tobacco control policies. 2, include illicit tobacco trade in training task force members, such as through the Empower training. Task force members are also multi-sectoral. You have PNP, you have barangay, and traffic, and so on. 3, understand and monitor local distribution lines for tobacco. So that's from manufacturing to distribution. 4, orient local policy enforcement teams on illicit tobacco trade where it could happen for increased vigilance. Number 5, enforce stringent gatekeeping measures for producers, for distributors, for retailers to ensure limited access to tobacco products, hence easier monitoring. Number 6, conduct regular inspections and spot checks. So this is LGU level. Report and LGU level, and usually done by the task force. Number 7, report confiscated trade to DOH through the RTCNs. Currently, reports are only through PNP for confiscated products, and BIR-DOF for taxation. Number 8, report the prosecution of violators to DOH as part of monitoring. Number 9, engage and work with other regional counterparts of national government agencies for increased support. So here, DOH really needs to work closely with DOF. And in fact, when we were looking at the RTCN groups, we would always we would check is do you include DOF in the RTCN or BIR and so on. So these are initial things that the RTCN can do. Number 10, empower local citizens. So this is the citizenry, general public, by engaging civil society or existing volunteer systems, barangays, for peace and so on, increasing vigilance at the barangay level. So these are just possible recommendations that we can start to explore and provide, and more of how we design or integrate illicit tobacco trade in the normal tobacco control programming for LGUs. Next slide. And I think that was also my last slide. We are very thankful to the Ateneo School of Government team, to the panelists, and for our colleagues also from IHO who helped us in the analysis and in the work. And we also look forward to have this formally published.